coding detached retina. This question had come up, and when it's actually a scenario that happened, so it's not necessarily all about detached retina. The question that came up was, okay, she says, so I'm coding lots of cases today, and here's the one that she's struggling with. Ultimately, you have a patient that comes in, they have a loss of vision, and as the case goes on, the patient is diagnosed with a detached retina, okay, and ultimately he can't get in seen by the doctor because of insurance. When we scroll down, we see that let's see that the patient's discharged, but this is what it says in his history. He has diabetes type 1, hypertension, okay, and then he has the detached retina. So what are they, her question is, what are we going to code for that? And her ultimate question is a diabetic code question. The code for the detached retina is 361.9, and the 250.51 is actually for diabetes with manifestation of ophthalmology, and 362.01 is retinopathy, diabetic retinopathy, and the 401.9 is for the hypertension. So if we go to the poll real quick, her question is, what is she going to do about the diabetic code? Does she do retinopathy? Now, if she does a diabetic code 250.51 with the manifestation for ophthalmology, ophthalmic conditions, man, my tongue's tied tonight, then she's saying that she would do the retinopathy. So in your opinion, just what you've seen so far, what do you think off the top of your head you would do? 250.01 or 250.51? 01 is diabetes type 1, 0.51 is diabetes with a manifestation with ophthalmic condition.
Easy for you to say.
Yeah, obviously not. You're right. Usually I don't twist over so many. So how are we doing? Are we getting them in there?
56% so far.
Okay, I'm real curious how you, and this is just eyeballing it, what you saw. We went through the case. I decided not to read the whole thing. Okay.
So 250.01 without mention of complication, type 1 juvenile type not stated as uncontrolled, and
right.
51 is diabetes with ophthalmic manifestations.
Yes.
So
your fifth digit is the distinguisher that tells them it's a type 1. So
so the question is, which is the correct fourth digit? All right, only 64% voted. Now we know from the other polls 75% can vote.
So I think they're just too nervous.
All right.
Let's see what they did.
Not like the coding police is going to come. Let's see.
That's right. Okay, so now 51% of you coded that they have a manifestation. So let's go look at the rest of the slide and see what I wrote.
So 82% with the 51. Okay.
Yeah. Because I can tell you, you're wrong. I wish I could do that little buzzer nose. Now, obviously, she was thinking the same thing, and this is what confused her. You have to look at the terminology. Nowhere in the information in the documentation that she gave us did the doctor correlate the detached retina as a manifestation of the diabetes. So, it's not the same. It has to say that it is a manifestation. It has to say with. It can't say in. It's those little words that'll get you every time. So what does the patient have? He has a detached retina, 361.9. He has diabetes, 250.51. There is no manifestation in there, and he has hypertension. Now, just so you know, for a detached retina, the things that are important, though, is the fact that he is diabetic and the fact that he has hypertension. Both of those conditions will affect his care. but he's there for the detached retina or and the diabetes. You cannot use the 0.50 unless you have a line that you can draw that the doctor specifically states that it's because of the diabetes, and that's not done. So you'd be coding inaccurately if you coded the 0.5. Okay? Now, if the doctor had stated that the patient had diabetic retinopathy, sometimes they'll just write D retinopathy. You've got to be able to tie those together. Then you could use the 0.51. Okay?
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.